let's quickly understand why and where and how did this entire, this therapy came into place, right? Because this is a time when we're talking about when psychoanalysis was something which was widely being used, okay? And it was the most loved therapy, and I think that was the only therapy which was more prevalent, and that is how most of the therapists then were indulging in psychoanalysis. While at the same time, what happened was in 1940s, that is the time when the World War II was happening, and the veterans, the war veterans who were coming back, now these were the people who were showing a lot of emotional issues. So there was a lot of problem with their emotional regulation. And at that time, the need was felt to come up with a therapy model which could be more, precise. It could be short, but at the same time, the effect could be as as it could be as effective as we had psychoanalysis at that time. But I'm sure, as all of you know, that psychoanalysis is a lengthy process. It takes some time. But that time, when they had like a rush of these war veterans who were just coming back home, and then there were a lot of these issues, right, from anxiety, depression, PTSD. So there were a lot of array of difficulties that these individuals were reflecting. And this was the time when a need was felt to come up with something which could be more short term, and it could also give similar and better results. Now, while this thought was already surfacing up, behavioral therapists were already in the, they were in the process of coming up with experiments where they were trying to measure, they were trying to analyze how behaviors were affecting person's emotional state, or how was it really affecting their feelings. So this thing was already going on, and in fact this is what was considered as the first wave of CBT, right? So this is where people started realizing, or say the thought was somewhere injected that, okay, we need to work on this field as well. Now, around 1950s, it was Albert Ellis who came up with REBT, Rational Emotive Behavior Therapy. And he was inspired by Adler, and that is where he came up with REBT. And now REBT was considered as the, the first batch of cognitive psychotherapies, if I could call it. It was the first among all the other therapies which followed. Now, from here, it was Dr. Aaron Beck who took over in 1960s. Now, Dr. Aaron Beck was a psychiatrist. He was a psychiatrist, and he was a practitioner of psychoanalysis. And he was predominantly, he was working in the area of he was working with patients who were diagnosed with depression, right? So while he was working with this kind of population, like people who were diagnosed with depression, he was also trying to conduct a lot of experiments on them with psychoanalysis. While he was doing this, what he realized was all of them, all of these patients who were diagnosed with depression, they had their own internal dialogues. So they would indulge in these self-talks and during the analysis process. And these indulgence, when he started looking at it minutely, what he found was these were generally negative self-talks. And these were a stream of thought. So it was a stream of thought from one to another, it would go on. And they were characterized as being negative. So most of the time they were negative. Also, they would be invalid, as in there was no proof to support that thought. But still, they would indulge in these thoughts. And now this is where Aaron Beck came up with, this premise that how these people were feeling is actually the result of these thoughts. And these thoughts are something what they are not even, consciously aware of. It is just happening to them. So it is very rapid and very brief, but the effect is very profound. But what is happening here is they do not really have control over it, and it is not, they are not consciously being aware of it. It is happening in an automatic way. And this is where the term automatic thinking came into place. Okay. So these thoughts, Aaron Beck called it as automatic thoughts. We'll be talking about automatic thoughts in detail as we go ahead in the session today. Now, while this automatic is what he picked up on. He also understood that if he could explain it to his patients, to his clients, that if you consciously pay attention to these thoughts, and if you're able to analyze them, you will also be in a position to change them, to correct them, in to make them a little more healthy, in a way that now the emotional state changes with your thoughts. So this was something which he started teaching his clients. And the moment he saw this change coming over, like where his clients, his patients were now being able to consciously pay attention to what they're thinking and consciously bring in a change in the way they were thinking, they also started experiencing a shift in how they were feeling, and also a shift in how they were behaving. And this is where the behaviors were more functional, and emotionally they were feeling much better. And this is where um, Beck came up with this entire concept of how cognitions, as in the thoughts, can be affecting one, their emotions and feelings, and their behaviors. And it was called as, this approach was called as cognitive therapy. Okay, pay attention now. I'm not talking about CBT here. The approach was called as cognitive therapy, which might also give rise to questions like, what is the difference? Is there a difference? Yes, there is a difference here. Why? Because cognitive therapy is what Beck gave us, but later on, what we now call as cognitive behavioral therapy, it is more of an umbrella term. Why is it an umbrella term? Because within this term, there are a lot of other psychotherapies which exist. Like, we have exposure prevention, response prevention, sorry. We have DBT, dialectical behavior therapy. We also have stress inoculation. So these are different therapies that we have which come under the term of CBT. So CBT is a broader term which is being used, but CT, which is a cognitive therapy, is what Beck gave us, right? But of course, now it is, we do not really call it only CT. We have come to a point where we call it cognitive behavioral therapy, because we find it to be more effective when we are trying to understand our clients and we're trying to help them.